Thanks for joining us today. I have in the studio with us Mr. Joe Riley. I'm Tom Fulmer, and normally we talk about drug testing or things related to drug testing. But today we're going to talk about something a little bit different. We live in some challenging times, and there have been a lot of things going on with people restricted from traveling, restricted from going places with all of this, the COVID virus out there and some situations like that. And now that things are starting to settle down just a little bit, there's actually been some testing that's come about and some other things coming up that will help us hopefully start getting back to normal. People are now wanting to go back to work and even start traveling, and certain things have to happen for them to be able to do that. And I know, Joe, you and I were talking about being able to travel, and certain things you can travel, but certain things have to happen in certain circumstances. I know you had that happen recently, right?
Yeah, so one of the things that I had a vacation planned, and I'll tell the story, but it's kind of led up to this, what we're going to be offering. We're going to be offering a COVID-19 PCR test that people can purchase and provide their specimen at home and send it into the lab and get the results back in 48 hours or less. And it is a PCR test, which is, actually testing for the active virus. But so I was planning on going to the Turks and Caicos on vacation, and we had a group of 12 people that were going down there, and they put up on their website that in order to enter the island, you had to have a COVID-19 negative test, and it had to be a PCR test. It had to be tested for antivirus. And it couldn't be one of those instant tests, and you had to upload it to their website within 5 days. So we started calling around. We got some clinics around town and the hospital system, and they said, yeah, we're doing COVID-19 testing. There's a couple of drive-through spots, and I'd ask people, well, how long does it take to get the results? And they said, well, it could be 5-6 days, but we've had some that have taken 2 weeks. And I'm like, well, we got 12 people that need a COVID-19 test, and from the time they take the test till the time they upload it to the website, it has to be done within 5 days. I said, that's not going to work. We rescheduled our test. We rescheduled our travel because we weren't going to get that done in 5 days. So then I got a call from one of the laboratories that we work with, Clinical Reference Labs. And early last month, they came up with a new test. It's a saliva test, kind of like a spit in the tube kind of test. And it's a PCR test, which is the kind of test that you need for travel or you might need for return back to work, and you can get the results back really quick. So with that, we're launching a COVID-19 PCR test. And you can tell us about the process, Tom, if you would.
Yeah, absolutely. And this makes it a really simple process because it all comes in a box. And that's one of the reasons we hadn't offered it previously. There was too many variables, too long of a time frame, no guaranteed on these. But they've actually come up with a system where everything's in the box. You have the instructions, you have the kit, you have the how-tos, and you use your cell phone. Everybody pretty much has a cell phone these days. You simply scan the code, you enter in some data, you have certain consent things that walk you right through it. It literally is just a follow the steps in the app. And that's something everybody can do and make it really simple. It includes the specimen bag, how to package it up, how to seal it, the specimen labels to be able to ship it right to the laboratory by overnight. And so they have a lot of the results the same day that the laboratory gets it. And they're actually doing testing 7 days a week. It's a very, very simple process. And then once your result comes back, it comes right to your cell phone. And there's certain security things that you created during the actual test that lets you go back in and access that result. And then you have a validated result in a very short period of time. And it's something that's an accurate result, something you can pretty much rely on there. One of the things people ask us about it, is it FDA approved? Well, it's not. It's authorized to an emergency use agreement through the FDA, but there's no approved devices yet because, with the testing and the time it takes for FDA approval, there's a lot of red tape for that. So there's none out there. So this is one of the best options available that can be used simple, easy. Anybody can do it. You can collect it, right there and send it in yourself and get a quick result. So it's a great process, a great product, and we're very excited to be able to offer that to our clients, who might need something like that.
That's outstanding. Let me ask you a few questions about this new COVID-19 PCR test that we're offering. First, real quick, can you order it on our website?
Yeah, so we actually have it available on the website, nationaldrugscreening.com. You just search for it right there. You can have a search and put in COVID-19. It's going to come right up. And then from right there, our team will process everything and get it shipped out either the same day or next day, just depending on time you order. Shipping's about 2 days to get to you. If you do need it right away, like an instance that comes up, you look around, you can't find a place, and you say, well, hey, I need this right away. Well, we have an overnight option. And you can choose that, so we will actually overnight it to you, and then of course you do it right away and overnight it to the lab. So you can definitely do that.
And so this is this an instant test at home?
No, so it's not an instant test, and that's what a lot of confusion is out there. And there's a lot of inaccurate results through quote instant testing.
Yeah.
This is actually a lab-based, lab-validated test overseen by the physicians group. So you're actually collecting the specimen per their guidelines, taking those steps. And then when you send it to the lab, it goes through actual testing by the laboratory, all the certified scientists reviews, all of that. So it's an actual validated test. Big difference between that and the instant test.
And again, once the lab gets this specimen, how quickly to get the results back to you?
Well, most of the results are within about 24 hours. A lot of the results, a high percentage of the results, are actually the same day they receive it. So when you overnight it, it actually gets to the lab between 4 to 6 in the morning, and they start testing immediately. So a lot of those results, if it's clear negative right away, then that result's going to release out. If they have to do a little additional testing, I mean, it could technically take up to 48 hours if there's other things, but most of your results are probably within about 24 hours.
Great.
Especially with them doing 7-day-a-week testing.
That's outstanding.
That's amazing, and that's a commitment on their side to actually provide a level of service that goes above and beyond. So.
Yeah. So what happens if someone tests positive? Is there any follow-up?
Yeah, so if you get a positive result, you are going to have the physicians are going to reach out to you to help you with those next steps, to help you determine what you need to do, and that's actually part of the test as well. So that's included. You'll get a notification by your phone. You'll be able to log in, and then you'll get that phone call and have that conversation with them for your next steps to reach out to your health provider or whatever steps you might need to take in that circumstance.
That's outstanding. So you actually talk to a physician and they walk you through it, and that's all included in the price.
That's included in the price, which is makes it a lot easier, because if you've got too many moving parts, it's really confusing. I mean, anything in healthcare can be confusing these days. They've done a great job of simplifying it and allowed us to provide that to our clients.
And so this test kit is sold to someone, an individual, a family of 5 or one person. They can buy 1 or 5 or whatever.
Mm-hmm. Yeah, quick clarification on that. So it's one kit is one person. So if you need more tests, you have to buy a kit for each person. Each person would go through that process. Each person has their own consents that they have to do. And this is part of that emergency use agreement through FDA that requires certain things happen. So you do have to follow that process. But yeah, you can order, if you have 5 people in your family, you can order 5 kits. You can order it for your friend. You can order it for anybody that you want. The kit and test is going to be attached to is whoever completes the test. So if you want to order it for your friends or family, you can do that and provide it to them, and then they'll go through the process, their cell phone, their consent, and then they'll be the ones that get those results.
Right. And this is not one of those nasal swabs, right?
So that's actually one of the ones that people talk to me about all the time. I've got some connections in the medical field, and they said, yeah, somebody went up and tickled my brain by going up through my nose. No, that is not what it is. It's a tube with a little funnel. You can just fill it with saliva. It's got a specific level. It's got stabilization fluid in it. You pop that off, pop the cap on, and do the sealing like it's supposed to, and it's really straightforward. Non-invasive.
Yeah, well, this is outstanding, because this will help a lot of people. Somebody's getting ready to travel and they need to show a negative test. They'll be able to show it. Yeah. They can get it quickly. I mean, they can get it in one day. They can get it to the lab the next day, so they can have it in pretty much 3 days. They'll have their result. People may need something to show their employer if they're coming back to work after being exposed or having the active virus, and many other situations where you just need to show that negative test, and it needs to be, what I kind of call an official test. It's that PCR terminology.
Right.
It's not an instant test, which is kind of just an initial screen. This is an actual lab-based test. Now, can employers buy this and give it to their employees to test themselves?
Yeah, so that's an interesting way that we can do that. So if you have employees, especially with many states talking about coming back to work and opening up more and more businesses, if you want to have something like that in place, you can buy that as an employer so that either you can see the results or they can provide those results to you. And it's a very quick and fast turnaround because now you're not waiting, like you said, 5 days, 7 days, 8 days to bring somebody back to work. You know, maybe you need somebody back working right now, and the employee needs to come back to work right now. You need to have something that's going to help them do that. So as an employer, you can absolutely do that. Doesn't matter how many people, you can test as many or few people as you want. You know, you really have the option. It's just per kit. There's not like it's a contract. You don't have to go through and set up an account or anything. You can simply go online to nationaldrugscreening.com and purchase it there, or you can call us and purchase it there. And if you're an employer, you'll get a chance to talk to somebody who works with employers to make sure we're getting everything you need the way you need it and the way resulting works and all that.
Yeah, because for employers, will they be able to get access to the results for their employees if they buy the kits?
Yeah, they can actually be set up so they can access the results, so they can verify that, and they can verify it right away, and then be able to bring somebody, right back to work. Yeah.
Well, this is really exciting, launching a product that will help people.
Absolutely.
And that's going to be effective, and it's not kind of vague as to when you're going to get the results, because I've heard, a lot of horror stories. Some people got them in 6 days, other people waited 3 weeks, and lots of different stories. And the laboratory that we're using, Clinical Reference Laboratories, is been around for a long time. Mm-hmm. They have a lot of certifications. Their SAMHSA certified lab, and we're looking forward to that opportunity. So that's great.
Yeah.
How do people order it again?
They just go online to nationaldrugscreening.com, give us a call, and you can pick up the number right there if you have additional questions. Very simple, very straightforward.
Great.
And avoid all the hassles, and we can all get back to work, get back to our lives, and hopefully get things a little bit more back to normal. And just glad to be a part of that.
Yeah, so don't forget, www.nationaldrugscreening.com.